Joining me now is Congressman Brad Wenstrup of Ohio. He, representing Wenstrup, he's a member of the Ways and Means Health Subcommittee, which I used to cover a long time ago, and is co-chair of the GOP Doctors Caucus. Congressman, thanks for joining us. Another regular at our events. Thank you so much.
Yeah, glad to be here. Thanks for having me back.
Well, Congressman, let's first talk a big general question. Ways and Means covers huge issues, including health care, trade, and taxes. What do you see on the agenda, and specifically, geared a little bit more towards the health care agenda?
Yeah, certainly. And healthcare agenda, I really think that we want to focus on the health of America. A lot of times when you hear the term healthcare, and especially associating it with a political structure of some type like Congress, most people start talking about their coverage and this and that, which is, of course, important. You want to have good access to care. But we're going to focus on more things that have to do with keeping Americans healthy. If you break it, we want to fix it. We don't want to stop that. But at the same time, what can we do to improve the health of America? And I call it health span versus lifespan, right? Even people with chronic diseases that we don't have cures for, how can we keep people as healthy as we possibly can for as long as we possibly can? So the topic today is an important one too, right? And when it comes to vaccines, certainly if you can get a vaccine that prevents you from getting something like polio, for goodness sakes, then it's a whole lot easier to pay for someone who's healthy than paying to treat somebody, especially when something can be prevented. So we're really talking about prevention, but at the same time, advancing cures, advancing new innovations, devices that can help people. And, in some ways too, we have to look at our process. Are we doing things well with the FDA? How important is the CDC to the American people and what the CDC has to say? So wide variety of topics, obviously, but the bottom line is how do we find ourselves able to deliver care, make it accessible, and do as much as we can to keep people healthy and prevent disease and illness?
Are you concerned, Congressman, since the pandemic, basically the other vaccination rates have gone down? I remember about 10 years ago, I was very busy. I didn't get the flu shot. I learned that lesson. And since that time, I've always gotten the flu shot, including this year, because not only, and it hurts the healthcare system because it's money out of my pocket, it's money out of healthcare. It's certainly efficient in that way. But are you concerned that not as many people are getting other types of vaccines? And what can you do about it? What's the role of the Doctors Caucus as well?
Well, one of the things that we really want to promote is the doctor-patient relationship. And if you think about a lot of medicine today, the doctor's taken out of it. You're getting a public service announcement or something like that. And we really should be encouraging people to go to their doctor to discuss vaccines, to be able to check and see what vaccines you have or have not gotten. And I think that's the key. Look, I'm pro-vaccine. I've been vaccinated. I got COVID. And so very much in favor of it, but there needs to be that discussion on all the vaccines with patients, that what the data really is, what the risk people are taking by not getting vaccines, what the risk is to our public health in our communities. And that has to come from a one-on-one conversation, because unfortunately, there's a lot of mistrust out there, right or wrong, whether it's through social media things, whatever the case may be. We really need to have accurate data at the disposal of physicians and do everything we can for patients to get to a doctor, have the conversation about their own personal health. And, we've got the systems that should show, a lot of times people forget. I don't know what vaccines I got as a kid. I don't know if I ever got them. Well, these systems, the BDS, for example, has that in there. That's not something that's government access. That's there for physicians to have access to. And so that can be very helpful, but you got to have that conversation with your doctor. And I think that that's really what we have to encourage. And I think we're all better served when people have the opportunity to be educated on why they need certain things rather than just told they have to get something.
We have an audience question, and it's a good one. Megan Wolf, Senior Policy Development Manager, Trust for America's Health, asks, what strategies are being considered and or implemented to ensure access to vaccines for individuals who are homebound?
Yeah, so we're looking at programs, hospital in your home, things like that, where you can actually treat people in their home or even considered hospital care. But also, I served on the Rural and Underserved Healthcare Task Force that we put together, bipartisan event between members on Ways and Means Committee, and we discussed access problems. Now, telehealth won't get you vaccinated, right? But telehealth may be able to identify someone who needs to get vaccinated. And can we deliver programs where it's prescribed by the doctor for the patient to get this and get to them in their home? You're as far as contagious diseases, hopefully you're safe in your home from getting or spreading them. If you are homebound, certainly you want to protect your family as well. But those are the access problems that we need to address if we're going to try and embrace the health of all Americans.
The Inflation Reduction Act, as you remember, was a very partisan debate. But as you know, Congressman, there's a lot of bipartisan things that kind of get thrown into a big bill, and the headlines focus on the fight, of course. There's a provision that we've been talking about that requires vaccination coverage through Medicaid and Medicare Part D. Do you think that's a good idea? And are you seeing that any effect at the local level yet, or is it maybe a little bit too early?
I spent 3 years on our Board of Health, and so public health is personal to me. I don't have a master's in public health, so I'm not claiming that. But I do have experience of treating patients over the years and being a physician who is required to get vaccines to do my job, to be in the hospital, et cetera. So I think that helps increase access. And in that same vein, I look towards insurance companies and I say things to them like, would you ever consider, if you have a patient with a chronic disease like diabetes, would you ever consider allowing them to have 3 visits a year where they don't have a copay? Because too many people are budgeting with their health care, so they don't want to go. But if you have a situation where something is free and that's in the best interest of public health, I think it's a good idea, because if you can prevent something, you save a whole lot more. I think of the cure for hepatitis C, too. We're talking about cures. A lot of people say, well, that's fairly expensive. Yeah, but do you know what it costs for a transplant or for your hospitalizations with your illnesses along the way? So, when we can do cures and prevention, sometimes it's a good idea for us to pay for it, because you'll pay a whole lot more later.
How have you been working on fostering bipartisanship? It still exists today, but it's very, very polarizing times. There's always a next election around the corner. Has that kind of debate gotten better? Because at times, as you know, it's been pretty nasty.
Well, the bipartisanship you never see on the news. I mean, it doesn't make the news. So people only see the big things where everybody's screaming and yelling, because I guess that's what turns on viewers. So we have our doctors caucus in the House, and we're doctors, dentists, and pharmacists. And on the Democrat side, there's now 4 physicians. And there are several things that individually we have worked on with our counterparts across the aisle, and that we've also done it as a doctors caucus. And just look at the No Surprises Act. The No Surprises Act was really driven by doctors on both sides of the aisle, where we really came together. We wrote the bill. We did it through Ways and Means, but we had tremendous influence in writing that bill, and people were listening to us. I'm on bills with Dr. Raul Ruiz from California. We have the Safe Step Act that deals with formularies limiting how you can treat patients. We have a bill on prior authorization that we passed out of committee on Ways and Means that's bipartisan. And so these issues do get addressed in a bipartisan fashion, especially by those that are in the arena or have been affected by some of the things that end up causing a delay in care or a denial of care. We come together pretty well on that. And I think if we continue to take the approach that we want to advance health in America and maybe steer some of the conversation away from just what your policy is, I think we're going to do a whole lot better.
Last question. As far as House Republican oversight on vaccines and these issues, is this going to be something that's going to get some attention? Because that's a good way also to educate the public.
Absolutely. You know, what I want to know at this point is what has been the real overall effectiveness of vaccines. And really, the mRNA vaccine that most Americans have gotten, it's a little bit different than the polio vaccine. In many ways, this vaccine is more of a treatment, if you will, and in many cases, a preventive treatment, at least prevention of getting very sick. And that's what we saw from the trials, that even if you've been vaccinated, you can still get COVID, but fewer people get it. And people don't get as sick and less likely to be hospitalized. We want to look at the data. We want to look at natural immunity. We want to look at the longevity of the vaccines as far as protecting you. We want to look at the effects of variants of the virus and the differences that happen there, where we've seen this, a new strain comes forward. We've dealt with that with the flu. So we need to really look at data and be holistic in the approach, and again, have good data that we can provide to providers that can sit and talk with their patient about what's best for them.
Last question. I want to get this one in because it's interesting. We're in Washington, D.C. I'm a D.C. insider, but I always like to ask members when they go back home, when you talk to doctors back home, and you mentioned, the No Surprise Act. That was not easy to get through, as you know. But what are you hearing from real physicians who are dealing with patients every day? What's their frustration with Washington?
This kind of goes to one of the things you were talking before I came on, burnout.
Mm-hmm.
The frustration with Washington is you spend more time of your day trying to appease Washington or the insurance company or someone else that never sees your patients, and you spend more time trying to appease them just so you can get reimbursed, paid for the work you do, and it really takes away from your time with patients, and it's very frustrating in many ways. And so the burnout becomes greater and greater. A lot of administrative things have been dumped on people. And now, look, when you have cuts to Medicare, you're cutting your reimbursement across the board because most contracts you have with private insurance are Medicare rates plus whatever. And there's only so much you can do and keep your doors open. And that needs to be understood. And I think the doctors today feel that the attitude from Washington is, we're paying you enough already. And so what they take that as, your service, we don't put much value in your service. And the bottom line is, then you start changing the way you practice and what patients you'll see. I don't want to go in to see a patient and worry about whether they're on Medicaid or they have some 100% payment of things. I want to go in and take care of patients and let the other chips fall where they may, but there's too much involvement with trying to please people and often this data has nothing to do with taking care of the patient that's in front of you. Mm-hmm. And so that's very frustrating. That's very frustrating.
Well, yeah, there's definitely a lot of frustration in the healthcare community toward Washington. Congressman, thanks so much for joining us. Really appreciate it.
My pleasure. Anytime. Thanks.